One of the major hurdles facing the coronavirus vaccine, getting people to take it. This issue of trust is especially deep in the Black and Latino communities. Even though they are being hit disproportionately hard by the pandemic, mistrust of the government and of the medical community may make some people reluctant to trust the safety of the vaccine. ABC's Zachary Quiche has more.
Overcoming systematic racism and collective trauma will be key components in the effort to vaccinate. Now there's a full-fledged PR campaign on to remedy the situation. President Obama and several other past presidents have pledged to publicly take the vaccine in an attempt to temper fears.
Absolutely, I'm going to take it.
And Dr. Anthony Fauci, the country's most revered infectious disease expert, has made his own pitch.
So the first thing you might want to say to my African-American brothers and sisters is that the vaccine that you're going to be taking was developed by an African-American woman. And that is just a fact.
Early evidence suggests it won't be that easy.
I'm a little bit skeptical because I want to know, how is it going to affect my immune system versus anybody else's? So I am a little bit leery.
While the virus continues to batter these communities at disproportionate rates, just 14% of Black adults and 34% of Latinos said they trust vaccine safety. There's a painful history of brutality against people of color. From the Tuskegee syphilis experiments, where scientists deliberately infected men and withheld treatments, to Henrietta Lacks, a young Black mother of 5 who in 1951 unknowingly had cells taken from her. The biomedical research led to breakthrough cancer treatment.
It's logical reaction to a healthcare system that continues to treat them in unethical and frankly dangerous ways.
Harriet Washington, the author of Medical Apartheid and A Terrible Thing to Waste, says a lot of these experiments were done not only for medical advancements, but to feed curiosities.
A doctor could do whatever he deemed fit with a slave, including conducting research. In fact, doctors put ads in newspapers saying, "I'm looking for slaves."
Anthony Williams, a cancer biologist at the University of Chicago, aware of the skepticism, sought to break the cycle of distrust and received his first shot of an experimental COVID-19 vaccine in October.
I eventually arrived at the conclusion that I wanted to join the trial because it's so important for especially us, our community, Black people, to enlist in this effort.
In communities like Washington Heights here in New York City, medical professionals are juggling the dark chapters of American medical history with current misinformation campaigns. They say it's all about trust.
My patients won't go to another doctor that tells them to get this vaccination. They will come to me because they trust me.
SOMOs, a group of more than 2,500 healthcare providers focusing on the most vulnerable communities, are working with Governor Cuomo to develop a plan to ensure that Black and Latinx New Yorkers have access to the COVID-19 vaccine.
We practice with the people, we speak the same language. We are immigrant like them. This is why they come to us.
The Black and Latinx communities are 2 to 4 times more likely to both get and die from coronavirus. It's what's often referred to as the social determinant of health. Eva?
Zachary Quiche, that very important report. Thank you. And let's get some more insight from Dr. Ashton, our chief medical correspondent. So, Dr. Ashton, we just heard from Zachary that a significant amount of Black and Latino Americans are not planning to take this vaccine, but they're also in communities that are disproportionately affected by this virus. So what do you say to those that are concerned about this vaccine?
Well, Eva, I think, first of all, concern, questions, those are all normal, and they are actually appropriate in medicine and science and public health. And as the saying goes, sometimes the messenger is as important as the message. So who is conveying this information and who is explaining how to help people evaluate risk? And I think what's really important is to help people understand that when you ask about the risk of this new vaccine, we have 2 months of short-term data in order for the FDA to give it authorization. You have to put those known risks up against the risks of getting severe COVID-19 disease or dying from COVID-19 disease. And you have to put those two numbers head to head. It's not the risk of an unknown that we can use in medicine and science. We have to go by facts and not fear, and evidence and not emotion. And if that information is conveyed clearly, then people can make the best decision.
And another concern that's come up as the vaccine is beginning to roll out is the fact that pregnant women have not been a part of the vaccine trial. So the question remains, should they get the vaccine?
Not at this point, Eva. You know, I've spoken to Dr. Anthony Fauci about this. I've spoken to Dr. Stephen Hahn, the FDA commissioner, about this. Trials, formal clinical trials, there'll be probably bridging trials, will start in that very special group of pregnant women very soon, January, February, as early as possible. So right now, they are not included in people who are indicated to get this vaccine. Of course, in the clinical trials, there were some women who became unexpectedly pregnant during the trial. But remember, in obstetrics, we're talking about 2 lives at stake, so they have to be studied separately.
Dr. Jen Ashton, some good information and good reminders for all of us this morning. Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.